Hello, everyone. This is Jessica Rial with Southern Pelvic Health, and I am so excited today to be talking with Dr. Jana Illston for our provider spotlight this month. Thank you so much for being here, Dr. Illston.
Thank you for having me.
So, Dr. Illston and I have known each other for quite a while. Before I moved to Atlanta and back, I think it was like in 2010 or something like that. I was living in Greenville, South Carolina, and Dr. Illston was in her OBGYN residency. And even at that time, she was really passionate about working with pelvic floor dysfunction and urogynecology. And so we connected then when she was working on her residency. She shadowed with me in the clinic, which is amazing. And I don't know that there are many physicians who treat pelvic floor disorders who have spent time shadowing with pelvic floor PTs. So I think that that's amazing. And she went on and went to the University of Alabama in Birmingham to do a fellowship, and then moved to Atlanta, and here we are now, both in Atlanta, reconnected many, many years later. So I am always really, really excited to be working with Dr. Illston, and she has such a incredible brain. And so I'm very excited to present her to you all so you can get to know her as an excellent provider in the community. So thank you so much again for being here and joining me today.
Thank you. It's always a pleasure to get to work with you, and I'm thankful to you for getting me started in understanding how much the pelvic floor impacts all of pelvic floor disorders.
Yeah. Well, so tell me just a little bit about your specialty. People hear about gynecologists, but urogynecology is different. And so tell me just a little bit about your specialty and what differentiates you from a traditional gynecologist.
Absolutely. Well, urogynecology is kind of a special blend between OBGYN and urology. And so I originally trained in OBGYN, and I'm not a urologist, but in fellowship, I did a lot of cross training for some urologic issues and with the urologists in Birmingham. And so I got a lot of experience dealing with pelvic floor disorders, prolapse, bowel and bladder incontinence, and other bowel and bladder dysfunction, as well as problems with pelvic pain, painful sex, and painful bladder syndrome, things like that.
Very cool. And I think it's a special type of person who ends up going into these types of specialties. Um, I know for myself, I had my own journey in going into pelvic health. But what led you into urogynecology as your specialty?
Well, I think, you know, even I was fortunate to grow up in a family of physicians, and so I got to see people who really loved what they did and loved taking care of their patients, and how fulfilling a career that was to them. And so when I was trying to decide if I was going to follow that same route, I ended up shadowing my mom, who practiced urogynecology as well. And so I got to see um, firsthand all of the people who would just stop us. Oh my goodness, your mother made my life so much better. She really helped me. Things were so miserable, and then she fixed it. She made it better. She helped improve my quality of life, and just seeing the impact that her care has had on women, through the years has been amazing. And so I thought that was really special. And then going on through medical school, I just really loved women's health, and I became very passionate about that. And I just thought it was such an amazing field, because these problems are so detrimental to quality of life, and often so embarrassing, and they can really make people's lives very unpleasant. But then when we can make it better, it's amazing, and people can get so much improvement, and feel so much better. And that's the really rewarding part of what I do.
Yeah, absolutely. I think for myself from the physical therapy side of things, it's we think about other problems that people have, like knee pain or back pain, and like while those things are
Mhm.
very impacting, most people can tell their friends all about it. You can go to work and be like, "Ah, my arthritis, my knee is really bugging me," but to go to work and say like, "Oh, it feels like my bladder's on fire," or
Mhm.
gosh, I've been to the bathroom 10 times this morning and I just still feel like I have to pee. And I mean,
Right.
they just tend to not be things people talk about. And, it's interesting, similar to you. I think when I have patients who will ask me, how did you get into this? I think really it has to do with the patient, to be able to impact people's lives in this tangible way and make a change for
Hmm.
private things that are so embarrassing for people. And I mean, we have patients who even their partners don't have any idea the thing that they're
Right.
dealing with. And so to be that ear that they can talk openly to, and then to actually help them no longer deal with that problem, is just so incredibly rewarding.
Hmm.
And I'm so grateful that you're there to help guide people through this. It's interesting growing up in a family with a lot of physicians and having your mom be a urogynecologist. I bet you were probably one of those. You were not one of those people that later on is like, oh, I just found out I have a pelvic floor. You probably knew things way earlier than many people did.
Well, I mean, growing up in a medical family, you have those moments where I remember being in pre-first and they were asking, well, why do we celebrate Labor Day? And I promptly raised my hand and said, well, that's the day all the women go to the hospital to have their babies. So,
I love
you know,
it. I love it. That's awesome. It's good. It creates, these open conversations. I think my daughters, and I'm sure yours too, will have similar stories to tell. I think my 4-year-old and I were practicing like proper mechanics for having a bowel movement yesterday, and I was like teaching her. I'm like, man, she knows more about like coordination for defecation than most adults do.
yep, I keep saying that. Now, just take your time and relax and just let it all come out in one go. Let the bladder do its work.
It's good. I love it. I love it. They're gonna be like super healthy pelvises and really knowledgeable. So tell me just a little bit about your approach to patient care.
Well, I think it's really important to have an individualized approach to patient care because it really depends on that person and her goals and what she's hoping to accomplish. I have a lot of academic training and I like to follow, the evidence-based medicine and keep up with the current recommendations and guidelines. But at the same time, we also have to look and see, well, where are her priorities and what does she need? So, kind of being able to blend those two things to see, well, what's going to be the right solution for this person.
Mhm. And some people, when they look at seeing someone like you, to because you have surgical training, and you look even at this your specialty, and it's female pelvic medicine and reconstructive surgery. I've had a lot of patients who get a little bit nervous, and some where I've had to kind of convince them to go see someone because they're like, but I don't know if I want to have surgery, and they're afraid that seeing a surgeon means that they have to have surgery. Can you talk a little bit about that? Like, how do you blend conservative care, surgery, and all that?
Absolutely. Well, you know, I'm a surgeon and I love to operate, but at the same time, I think it's really important to know when to operate. And there are always conservative options. And, I think it's important. I like to present everybody with what are all the options. And so we go through, hey, here, you can do nothing. You can do conservative management. These are our options there. And then these are the options for surgical management. And then, a lot of people really want to exhaust all the conservative options. And so there are quite a lot of things that we can do usually. And I tell people too, like I have some ladies who come see me because they noticed a bulge when they were washing and they thought, oh my goodness, something horrible is happening. What terrible things are going to happen to me if I don't do something about this? And so they come to see me and they're very worried. And then once we talk and I examine them and we see kind of what's going on, and it turns out they're really not bothered. And then we get to talk about how, well, if you're not bothered, then we don't really necessarily need to do anything. It may never even get worse. And so, there are a lot of times where I tell people you really don't need to have surgery. And I only want to do surgery if it's really going to help somebody. And if somebody is already happy with how they are, then I don't have a lot of room to improve that. So we do have almost always some good conservative options. And so I really like to, to use those as appropriate.
Yeah, yeah, and I know you're a big,
Um,
you love working with pelvic floor PTs as well.
yes.
Yes, which often we end up working together a lot for patients to try to help with the conservative side
Hmm.
of things, which I think sometimes when people end up having surgery can help them to have better outcomes too down the road because they're aware of what's going on with
Absolutely.
their body, and their habits, and all those pieces are working in their favors too.
Absolutely. And I think the physical therapy is often such an important component because, um, you know, it just helps so many things, and it just making sure that the muscles are optimized and coordinated and helps with all sorts of dysfunction and then also pain. It's such a tremendously beneficial thing. And so even with surgery, I think PT is very often a useful adjunct.
Mhm. Yeah, I mean, we love, part of what we do here is we don't like to be little islands treating patients by ourselves. We like to
Yes.
collaborate and work together, because people just tend to do better when we're all working together. Um,
Absolutely, because you guys can give me feedback on what you're seeing from a musculoskeletal level,
Vice
and
versa.
then I can add, medical adjunct or potentially surgical things as well.
Yeah.
So it is
Yeah.
nice.
Yeah.
I love getting to pick your brain too.
Yeah, vice versa, vice versa. So tell me a little bit about, in terms of the diagnoses that you treat, what are your populations that you just really love working with?
Well, I actually really enjoy all sorts of different pelvic floor dysfunctions. So I work with all sorts of things from, um, you know, bladder pain, pelvic pain, painful intercourse, also incontinence, bowel and bladder incontinence, both, um, and other bowel and bladder issues. One of the things I'm super passionate about also is prolapse.
Mhm.
That's one of the things that I really enjoy working with a lot too. Um,
And can you just for a minute, because our community, we have a broad community, so we have some people who are going to be very familiar hearing the term prolapse, but then
mm,
there are other people who might be working with us or connected with us for other pelvic health problems, but they might not really know what prolapse is. Can you just talk for just a minute just about what prolapse is?
Absolutely. I wish I had my visual aid right with me here, but
Oh, that's okay.
um, so prolapse is, if you think about it, you've got the if this is the bladder and the urethra, and then you've got the vagina here in between, and then the rectum's back here, right? And you've got a wall of connective tissue in between the vagina and the bladder, and then also another one between.
Does that work?
Yeah, that will work. So uh, there you go. Perfect. So if you look in between, you've got the bladder there on the left, and then the rectum on the right, and then you've got the uterus with the vagina in between. And you see those areas in between are areas of connective tissue. And I like to say they're like a little trampoline. And you can imagine, and like the vagina is like a sock encased in a trampoline.
Mhm.
Okay. And so when that trampoline is ripped or torn or otherwise, detached and not supported well, then it's not there to hold the bladder up well, or not there to hold the rectum where it's supposed to be. And so then the bladder can kind of fall down into the vagina. And so when you see prolapse, you're seeing the vaginal walls bulging out at you. It's not like your bladder's open to the world or anything, but you still have
People
the
worry
vagina
about
there.
it.
But yeah, people absolutely worry about it. But you've got the vagina there, but then the bladder's kind of bulging down behind it, or the rectum's bulging behind it, or sometimes the top of the vagina or the uterus is coming down as well. And so people will often feel like their parts are falling out, or they're sitting on an egg, or they or a ball, or they have a kind of a nagging feeling that they're like a tampon's hanging out, but it's not, or they feel like a baby's crowning. Those are kind of common symptoms that people have. And it's one of those things that we can actually, if we can get the prolapse back inside, and then they feel a whole lot better. And
Yeah.
often things will function better too.
Yeah, yeah. And I think it's something that is very common, especially after people have had babies, and can be so impacting for people to feel pressure, to feel like there's something coming out of their vagina.
Absolutely. It can be very uncomfortable. But then the good news is that, early on things can be very helpful, like working with you guys, trying to optimize the muscles and make things more comfortable. If the vagina is low on estrogen, then we can treat that and make things more comfortable. Sometimes wearing a pessary can be really helpful. And then when those aren't the right answer, then we also have surgeries.
Mhm.
And I'm not somebody who uses a lot of mesh for prolapse surgery. So usually we can do it using their own tissue and some stitches, and lots of ladies do really well.
Yeah, yeah. And I know it can be, when we think about changing up these problems that are so impacting to our lives. I know this is a big area where people feel a lot of relief when things feel better down there.
Yes.
So that's awesome. That's awesome. So tell me, what's one thing that you'd want to share with our community?
Well, one thing that I hear from a lot of people, so I'll be talking to a lady doing an exam, and I'll say, "Oh, how are your bowel and bladder behaving?" And they're like, "Oh, well, I'm just getting older." And then if we, dig a little bit deeper there, it turns out, well, she's really got a lot of bother from incontinence, whether that's bowel or bladder or both, and
Mhm.
or maybe she's got prolapse and her mom had prolapse, and so she just thinks that's what she's got to deal with. And so the thing I guess I would say is just that just because you're getting older doesn't mean that you have to suffer with these problems. It's true that these things become more prevalent and more people have them as you mature, but at the same time, there's lots of stuff we can do. And again, it doesn't always involve surgery. Sometimes surgery is the answer, but sometimes it's not. And so just because you don't want to have a surgery doesn't mean that you can't get some relief from all of the inconvenience and embarrassment and discomfort that can come from these problems.
Yeah, absolutely. It's so sometimes taking that first step, I think, is the hardest thing for people, to step out of their comfort zone and go get
Yeah,
evaluated, go see someone. Um, but it can be so life changing. And I think if people listening, and many of them are in our community, and so they've worked with providers or with us, uh, and they are taking these steps. And so if you are someone who's taking a step, good for you, because it's hard. And
absolutely.
and I think that you're amazing for taking this step and making change for yourself. And if you're someone who's been thinking about it and you're not sure where to start, then come work with us and see Dr. Ilston. And we are happy to help guide you along this process, and guide you in offering choices. So like you were saying, that you offer all these options and then they get to choose. It's always their choice to
Absolutely.
decide what they want to pursue. So um, awesome.
Mm. I
Well,
think sometimes it's empowering just to know that there are choices. And then at that point, it's your decision. Is it something you'd rather do than what you're currently suffering with?
mhm, 100%.
Are you in control? Yeah.
Yeah. Well, awesome. Well, thank you so, so much for hanging out with me and for sharing with our community today. I just really, really appreciate you. And we're so grateful that you're in the metro Atlanta area. So thank you very, very much.
Thank you.
All right. Bye, everyone.